All right, so get ready to have your mind blown because today we are diving deep into the world of the right ventricle,
Mm.
that often overlooked chamber of the heart.
Right.
I used to think it was no big deal.
Right.
But this research totally changed my perspective.
Okay.
We're talking about a 2023 review from the New England Journal of Medicine, so top-notch stuff,
Yeah.
that really dives into why the right ventricle is way more than meets the eye.
Yeah, it's a fascinating area of cardiology,
Yeah,
often overshadowed by its more famous counterpart, the left ventricle.
right.
But as we'll see, dismissing the right ventricle is a big mistake.
For sure. And we're going to unpack why that is in a way that will make you sound super smart at your next dinner party
Right.
without overwhelming you with technical jargon.
Right.
Because let's be honest, who wants a lecture?
Yeah. Yeah. We're going for a fascinating conversation here.
I can definitely promise fascinating.
Okay, good.
Did you know that back in 1943, some researchers actually thought the right ventricle was less important because in their animal studies damaging shot, it didn't seem to have a huge effect.
Wow. Talk about a miscalculation.
Yeah.
What were they missing?
Well, as with many things in science, our understanding evolves.
Right.
Those early studies had limitations.
Mm.
And, the success of the Fontan procedure,
Right.
which actually bypasses the right ventricle in certain congenital heart defects,
Right. The Fontan procedure.
seemed to initially support the idea that maybe it wasn't so vital after all.
It's incredible. Literally a lifesaver.
Right.
But I guess like a lot of medical advancements, the long-term implications take time to surface. Exactly.
Yeah.
And what researchers later found was pretty shocking.
Okay.
Even in otherwise healthy patients, those who underwent the Fontan procedure showed a significant decrease in exercise capacity,
Really?
like a whopping 40% reduction.
Oh, 40%. That's huge. So much for being less important.
Yeah,
Clearly, the right ventricle is pulling its weight, even in a healthy heart.
it is.
So let's set the record straight.
Okay.
What does the right ventricle actually do?
In the simplest terms, it pumps blood to the lungs to pick up oxygen.
Okay.
Seems straightforward, right?
Yeah.
But it's the foundation for everything else.
Right.
And here's where it gets really interesting.
Okay.
The right ventricle isn't some isolated pump.
Okay.
It's directly connected to the left ventricle.
Right.
And they work together in a beautifully coordinated way.
Hmm.
We call this ventricular interdependence.
Ventricular interdependence. Okay,
Yeah.
I'm already sensing a theme here.
Huh.
Everything's connected.
You got it.
Okay.
And this connection is critical.
Right.
If there's a problem in one ventricle,
Mm-hmm.
it will inevitably impact the other.
Right.
For example, if the left ventricle isn't working properly,
Okay.
you get this buildup of pressure
Right.
that can back up into the lungs.
Oh?
And guess who takes the hit?
The right ventricle.
The right ventricle.
Right.
Suddenly, it's dealing with all this extra pressure, working overtime just to keep up.
So like a chain reaction, one problem can snowball into something much bigger.
Precisely.
Right.
And this interconnectedness is why the right ventricle is implicated in so many conditions.
Yeah.
Think left heart failure, pulmonary hypertension,
Yeah.
even severe cases of COVID-19.
Wow.
It's a crucial player in the grand scheme of cardiovascular health.
Okay, I'm officially convinced.
Good.
No more right ventricle neglect.
No.
But before we get into what can actually go wrong,
Okay.
let's talk anatomy for a sec.
Good.
The article describes the right ventricle as crescent-shaped and thin-walled.
Right.
Is there a reason it's built that way?
Absolutely.
Okay.
The right ventricle's unique structure is key to its function.
Okay.
That crescent shape and thin wall.
Yeah.
It's all about efficiently pumping blood to the lungs.
Okay.
But this design also makes it more vulnerable to certain types of damage.
Hmm.
And to really understand why
Yeah.
we need to consider its development.
Okay.
You see, the right ventricle develops from a different part of the heart than the left ventricle,
Hmm.
which actually influences how it responds to stress and disease.
Wow. So even at the cellular level, there are important distinctions between the two ventricles.
Exactly.
Wow.
And remember that thin wall we talked about?
Yes.
It means the right ventricle is way more sensitive to changes in pressure and volume compared to its thicker-walled counterpart on the left.
Right.
It's a delicate balance.
A delicate balance functioning within a complex interconnected system.
Right.
Okay, now I'm really starting to see why right ventricular failure can be so tricky.
It is.
Okay.
And it's often misunderstood.
Yeah,
But that's what we're here to unravel with.
you know it.
Okay.
So we've established the right ventricle is crucial,
Right.
but what happens when things go wrong?
Right.
How does this often underestimated chamber fail?
Well, to understand how this delicate pump can fail,
Okay.
we need to dig into the mechanics
Right.
of how it works and when it goes wrong.
Right.
Think of it like a car engine.
Oh, I knew we'd get to the car engine analogy. I'm
Yeah.
ready.
Okay,
Hit me with it.
perfect. Because it really is the best way to visualize this.
Okay.
So picture your heart as this powerful engine, right?
Okay.
But instead of fuel, it's pumping blood throughout your body.
Mm. Right.
Now, just like any well-tuned engine,
Yeah.
your heart relies on several key factors to function properly.
Okay, so what are the engine parts we need to understand when it comes to the heart?
We've got preload,
Okay.
afterload,
Okay.
contractility,
Okay.
and lusitropy.
Four horsemen all riding in different directions.
Yeah.
Sounds like a recipe for disaster. But seriously, break it down for me.
Good.
What do those even mean?
Okay, so preload,
Okay.
think of that as the amount of fuel in the tank,
Right.
which in this case is the blood returning to the heart.
Okay.
Got it.
Got it.
Okay,
Preload equals blood flow back to the heart.
right. Next up, afterload.
Okay.
Imagine driving uphill.
Okay.
That resistance the engine has to work against
Right.
for your heart.
Yeah.
That uphill battle is the pressure in the arteries.
Right.
The higher the pressure, the harder the heart has to pump to overcome it.
Okay. So afterload is like resistance training for your heart.
Exactly.
Makes sense.
Now,
Yeah.
imagine your engine's power, its ability to pump.
Okay.
That's contractility.
Okay.
A strong engine means efficient pumping.
So contractility is like horsepower for the heart.
Exactly.
I'm following so far. What about lusitropy?
Okay.
That one sounds like a mouthful.
Lusitropy is all about relaxation.
Okay.
Think of it as the engine cooling down after a hard run,
Right.
allowing it to refill for the next cycle.
Yeah.
For the heart, it's that crucial moment between beats
Right.
where the chambers relax and refill with blood.
Okay, so we've got our four horsemen, our heart engine all mapped out.
Yeah.
How do these factors actually cause right ventricular failure?
Well, any problems with these four,
Right.
whether they happen suddenly or develop gradually, can really throw a wrench in the works.
Yeah.
The article you shared dives into both acute and chronic cases of right ventricular
Oh,
failure.
right, like a sudden breakdown versus wear and tear over time.
Exactly.
Okay.
So for a dramatic example, let's say you have a pulmonary embolism.
Pulmonary embolism.
Yeah,
That sounds scary.
it can be.
Okay.
It basically means there's a blockage in an artery in the lungs.
Right.
And because it happens suddenly,
Yeah.
it causes a rapid increase in afterload.
Oh, right.
Remember that uphill driving analogy?
Right, yeah.
This is like slamming on the brakes while driving uphill.
Yikes, that's a recipe for disaster.
Yes,
No wonder a pulmonary embolism is a medical emergency.
it is.
Wow.
It puts immense strain on the right ventricle.
Right.
Now,
Yeah.
on the flip side,
Okay.
you can have chronic conditions
Right.
like pulmonary hypertension,
Right.
where the pressure in the arteries of the lungs is constantly high.
Right.
It's like driving uphill all the time.
Yeah.
That constant strain wears down the right ventricle over time.
Talk about a workout gone wrong.
Right.
So whether it's a sudden impact or constant pressure,
Exactly.
the right ventricle takes the hit.
Exactly.
Okay.
And we can't forget about contractility,
Right.
that engine power we talked about.
Right.
If the heart muscle itself is damaged,
Yeah.
it can't pump effectively.
Yeah.
A prime example is a myocardial infarction,
Right.
also known as a heart attack.
Everyone's heard of a heart attack,
Yes.
but it affects the right ventricle differently than the left right.
You're right, they present differently.
Hmm.
While both ventricles can be affected if you have a heart attack that primarily impacts the right ventricle.
Right.
It directly impairs the heart's ability to pump blood to the lungs. Imagine a car engine losing power because of a damaged cylinder.
Right.
It can't function at full capacity.
Okay, so the engine analogy really makes it clear how these different factors play a role.
Right.
What about lusitropy, the relaxation part?
Yeah.
Can problems with that cause ventricular failure?
Absolutely.
Okay.
If the heart can't properly relax between beats,
Right.
it can't refill with enough blood,
Right.
imagine your engine overheating because it can't cool down.
Right.
Not good.
Yeah.
This can be caused by a buildup of scar tissue in the heart muscle
Okay.
called fibrosis,
Right.
which makes it stiff.
Right.
Another culprit is constrictive pericarditis,
Right.
where the sac surrounding the heart becomes inflamed and restricts the heart's movement.
So instead of a smooth rhythmic cycle,
Right.
the heart is basically fighting against itself.
Exactly.
Wow.
And just like a neglected engine,
Yeah.
all of these issues, whether it's preload, afterload, contractility or lusitropy,
Yeah.
can lead to a cascade of problems,
Right.
ultimately resulting in right ventricular failure.
Okay, that was a truly helpful breakdown. I feel like I could diagnose a car
Yeah.
or maybe even a heart now. But
Bro.
this New England Journal of Medicine article you sent goes even deeper, right?
Yes.
We're not just talking about the mechanics,
Yeah,
but what's happening at a microscopic level.
you're right.
Okay.
Because just like with a car engine, the real magic and the potential problems are happening at a much smaller scale.
Okay, so time to break out the microscopic goggles.
Yeah.
What kind of cellular chaos are we talking about here when it comes to right ventricular failure? So we're going microscopic.
Yeah.
What's going on at the cellular level when the right ventricle starts to fail?
Well, imagine looking at that car engine under a microscope
Right?
and seeing the pistons and gears struggling to do their job.
Okay.
It's kind of like that with the heart.
Okay. I'm picturing tiny, overworked engine parts.
Right.
What are some of the key players in this cellular drama?
One of the biggest is hypertrophy.
Okay.
You know how muscles get bigger when you work out?
Yeah.
Well, heart muscle cells do the same thing when they're under constant stress.
Right.
They bulk up trying to handle the increased workload.
So the heart is basically hit in the gym. That sounds like a good thing.
It is initially. This kind of hypertrophy,
Yeah.
called homeometric hypertrophy,
Right.
is the heart's way of adapting and trying to stay strong.
Right.
But imagine if you kept lifting heavier and heavier weights without giving your body a break.
Yeah.
Eventually it would backfire.
You'd get burnt out, injured.
Exactly.
Yeah.
And the same goes for the heart.
Right.
Over time, that hypertrophy can become detrimental.
Okay.
We call this heterometric hypertrophy.
Okay.
The heart muscle cells get so large that they start to crowd each other. The heart walls thicken, and the heart chambers actually get smaller and stiffer.
Wow.
Plus, those massive cells need more oxygen and nutrients to function,
Right.
which can strain the heart's own blood supply.
Right.
It's a case of too much of a good thing.
Okay, so hypertrophy, good at first,
Right.
but can turn into a problem. What else is going wrong at the cellular level?
Well, remember when we were talking about the heart becoming stiff?
Yeah.
There's another culprit called fibrosis.
Okay.
Imagine your car engine slowly being infiltrated by this stiff, inflexible material,
Yeah.
making it harder for all those finely tuned parts to move smoothly.
That sounds like a recipe for a breakdown.
It is.
Yeah.
Fibrosis in the heart is essentially scar tissue.
Right.
It happens when the heart is damaged
Yeah.
and the body tries to repair it.
Right.
Unfortunately, the scar tissue doesn't function like normal heart muscle.
Okay.
It makes the heart less flexible and less efficient at pumping.
So it's not just about the heart muscle getting weaker, but actually becoming structurally compromised.
Exactly.
Wow.
And the crazy thing is, we can actually see this happening using cardiac MRI. It's amazing.
Wow.
We can visualize the extent of fibrosis, which gives us a clearer picture of how well the heart is actually functioning.
Wow. It's like having X-ray vision into the heart.
Right.
So hypertrophy, fibrosis,
right.
anything else wreaking havoc in the right ventricle's microscopic world.
Oh, absolutely.
Okay.
We can't forget about ischemia.
Okay.
Remember how those bulked up heart cells we talked about need more oxygen and nutrients?
Yeah.
Well, when the heart's own blood supply can't keep up with the demand,
Yeah.
those cells start to starve.
Yeah.
That's ischemia.
And that's bad news, right?
Very bad news.
Yeah.
And unfortunately, the right ventricle is especially vulnerable to ischemia.
Okay.
You see, unlike the left ventricle,
Yeah.
which mainly uses glucose for energy. The right ventricle prefers to run on fatty acids.
Okay, so different fuel sources.
Yeah.
How does that make the right ventricle more vulnerable?
Well, it has to do with the way those fuel sources are metabolized.
Okay.
Using fatty acids for energy requires more oxygen compared to glucose.
Right.
So when the heart is under stress and blood flow is already compromised,
Yeah.
that reliance on fatty acids puts the right ventricle at a disadvantage.
Right.
It's like trying to run a gas-guzzling car on fumes.
Ah, I see.
Yeah.
So even something like diet can have an impact on the right ventricle.
You got it.
Wow.
The article actually highlights obesity and insulin resistance
Yeah.
as key risk factors for right ventricular failure.
It's like that saying, you are what you eat.
Right.
But in this case, it's more like your heart is what you eat.
Exactly. It all comes back to that interconnectedness we were talking about earlier.
Yeah.
Even things we might not think of as being directly related to our heart health
Right.
can have a significant impact at the cellular level.
Okay, so we've got those overworked, oxygen-deprived heart cells, the stiffening effects of fibrosis, and the potential for things to go haywire with hypertrophy.
Yeah,
It's like a recipe for disaster.
it can be.
Yeah.
But remember, the body is remarkably resilient,
Yeah.
and there are things we can do to support heart health,
Right.
even in the face of these challenges.
Right. And you know what I find fascinating about this whole discussion?
Yeah.
Is that we often think of the heart as this kind of like singular, powerful organ.
Right.
But when you really break it down, it's this intricate system
It is.
with all these different parts working together.
Yeah.
And when one thing goes wrong, it can have these ripple effects throughout the entire system.
Yeah, it's a complex system for sure.
And it really highlights the importance of understanding these underlying mechanisms.
Yes.
So we can better diagnose, treat, and hopefully prevent these conditions.
Exactly.
Well, on that note, I think we've covered a lot of ground today.
We have.
We've gone from overlooking the right ventricle to really appreciating its complexity.
Yeah.
And I think that's a great place to wrap up our deep dive.
I agree.
So for everyone listening, remember to check out the show notes for links to the research we discussed.
Right.
And until next time, keep those brains curious and those hearts healthy.